Hello, hi, good afternoon everyone. Myself Dr. Antagiri. Welcome back to my channel, New Sai Apollo Hospital and Healthy Talks by Dr. Ante. So in the last video we discussed about heart sounds and action potential of ventricular myocyte and action potential of SA node and cardiac cycle, right? In this video we are going to discuss about JVP, jugular venous pressure. So what is the definition of jugular venous pressure and what are the waves are present in the jugular venous pressure and what are the abnormalities of jugular venous pressure, in which disease condition which waves are present or which waves are absent. We are going to discuss about that, right? So the definition of jugular venous pressure, right? JVP means the normal JVP is about 6 to 8 centimeters, 6 to 8 centimeters of Hg, mercury. What is the definition of jugular venous pressure? The jugular venous pressure means, which indicates that the pressure exerted by the right atrium indicates the jugular venous pressure. For example, let me draw one diagram for you. This is the heart. Simply this is the heart. Here this is the right side of the heart, this is the left side of the heart. The right atria, left atria, right ventricle and left ventricle. In this jugular venous pressure we are only going to discuss about the right atria. Only just concentrate on this one chamber only, the right atria. The pressure in the right atria is indicated by the jugular venous pressure. The right atria receives the blood, deoxygenated blood from inferior vena cava and the superior vena cava. This superior vena cava is formed by external jugular vein and internal jugular vein. This is the superior vena cava, which is formed by the combination of external jugular vein and this is the internal jugular vein, right? The internal jugular vein directly is connecting to the right atria, right? That's why the pressure exerted in the right atria is denoted by the internal jugular vein, that is called jugular venous pressure. Jugular venous pressure, nothing but it is the pressure exerted by the right atria is called jugular venous pressure. The normal value of the jugular venous pressure is 6 to 8 centimeters of Hg. So that is the definition. Simple. The right side of the heart, the right atrium is receive the deoxygenated blood from the inferior and superior vena cava. This superior vena cava is formed by the combination of external and internal jugular vein. This internal jugular vein directly having connection with the right atria. That's why if there is any pressure changes in the right atria is indicated by the pressure in the internal jugular vein, that is called jugular venous pressure, right? In this jugular venous pressure there are some waves. Let me draw one diagram for you. So this is the definition of the jugular vein, jugular venous pressure. Here this is the diagrammatic representation of the jugular venous pressure. In this jugular venous pressure curve, there are 3 positive waves. There are 3 positive waves and 2 negative waves. X descent and Y descents are the negative waves. A, C waves are the positive waves present in the jugular venous pressure. How the A wave is produced, what is the C wave, what is the V, and what is the X and Y descent indicates in the jugular venous pressure, we will discuss now. Here, let me draw one only right atria. This is the heart. This is the right side of the heart, left side of the heart. This is the right atria, left atria, right ventricle, left ventricle. This is the internal jugular vein, right? During the right atrial systole means contraction. During the right atrial systole, the pressure in the right atria is increased, right? The pressure in the right atria is increased. When the pressure in the right atria is increased, it indicates the increase in the jugular venous pressure. This increased jugular venous pressure during the atrial systole is indicated by the A wave. During the atrial contraction, the pressure is increased in the right atria, which is indicated by the A wave. Simple. A means atrial contraction. See here. A means atrial contraction. After the atrial contraction, the blood is pumped into the right ventricle. In the cardiac cycle, we discussed about it. After the atrial contraction, the blood is pumped into the right ventricle. At that time, the pressure in the right atria is decreased. Then the negative wave is produced. Then the waves are going to the negative side. After emptying of blood from the atria into the right ventricle, the tricuspid valves are closed. The tricuspid valves are closed. After the atrial systole, it is followed by right ventricular systole, right? Systole, diastole, systole, diastole. Right atrial systole is followed by right ventricular systole. When the right ventricle is contracting, the tricuspid valves are closed. The closing of both AV valves, mitral and tricuspid valve, produces first heart sound. Yesterday we discussed about this. After the right ventricular filling, it goes into the systolic phase. During this systole, the tricuspid valve is closed. In this, the closing of tricuspid valve is again, it produces little bit rise of pressure in the right atria. After the closing of the tricuspid valve, sudden closing of tricuspid valve, the pressure in the right ventricle increased, then the bulging of this tricuspid valve little bit increase the pressure in the right atria. This bulging of tricuspid valve into the right atria produces small positive wave. That is called C wave. C wave means closer or bulging of tricuspid valve into right atria produces little bit rise of pressure. So A means atrial contraction, C means closure of tricuspid valve. After the closing of tricuspid valve, what happens? The right ventricle contracted, the blood from the right ventricle, it pumps into the pulmonary trunk. During this right ventricular systole, the pressure in the atria is decreased, then the atria is emptied, right? When the ventricle is contracting, then atria is relaxing. During the right ventricular systole, the atrial diastole may take place. Ventricular systole, atrial diastole. During this diastole, the pressure is decreased. The decreasing in the pressure in the right atria decrease the jugular venous pressure also. You got my point? During the right ventricular systole, atria may going to relaxation stage, atrial diastole. So this is indicated by X wave. During the atrial relaxation, the pressure in the right atria is decreased. The decreasing pressure in the right atria may leads to decreasing pressure in the internal jugular vein. That is called decreasing, that produces X descent. Means X means atrial relaxation, simple, atrial relaxation. What happened after the atrial relaxation? After the atrial relaxation, what happened? Again the atria is going to filled with the blood. From where? The blood is coming from inferior vena cava, superior vena cava. Next is the V wave. It's going to the positivity. Means here after the atrial relaxation, the blood is going to be filled in the right atria, which is indicated by the V wave. Right? This is the V wave. V wave nothing but you just remember like this. V means venous. Venous return. Venous return to the atria. When the venous filling, venous return to the atria, the pressure in the right atria is again increased. Automatically it increases the pressure in the internal jugular vein, again produces V wave. That is called, V means venous return. Return to the right atria. From the superior vena cava and inferior vena cava. Automatically the volume is increased in the right atria, then it leads to increase the pressure in the right atria, which also leads to increase in the pressure in the internal jugular vein, that is JVP is also raised, which is indicated by venous return, V wave. After the venous return, so again the right atria filled with the blood. What happened next? When the atria is relaxed, it filled with the blood from the superior vena cava and inferior vena cava, then again it leads to contraction. Right? During this contraction, the blood is pumped into the right ventricle. That is produces again Y descent. Negative means when the blood from the atria is pumped into the right ventricle, the volume is decreased in the right atria. At the same time, the pressure is also decreased. Automatically it leads to decreasing in the JVP, jugular venous pressure. So Y descent indicates emptying. Y descent indicates emptying of blood. Emptying of blood, atrial blood into ventricles. So guys, simply you can understand, mainly the pressure in the right atria is indicated by the jugular venous pressure. When the pressure is going to rise in the right atria, leads to increasing in the JVP. When the pressure is decreased, JVP is also decreased. How it is produced? During the atrial contraction, the pressure automatically increases in the right atria, leads to A wave. After the atrial contraction, the blood is pumped into the right ventricle. It is followed by closing of tricuspid valve. By the closing of the tricuspid valve, sometimes it leads to just bulging outwards, bulging of tricuspid valves into atria. which mildly produces small pressure in the small rises of pressure in the right atria leads to increasing in the JVP, which produces C wave. After the right ventricular, after the bulging of the tricuspid wall, closing of the tricuspid wall, the right ventricle going to systolic phase. During the right ventricular systole, the atria is going to relaxation. In this relaxation, the pressure in the pressure as well as volume of blood is decreased, at the same time leads to decreasing the pressure, leads to relaxation, X descent. X means atrial relaxation. X wave indicates atrial relaxation. After the relaxation, again it's going to be filled with the blood from inferior vena cava and superior vena cava. When the blood is going to be filled in the atria, again it leads to rising of pressure in the right atria, which will automatically increase the JVP. After the filling of right atria, again it leads to atrial contraction. Means this filling of the blood is emptying into the right ventricle, produces another wave that is called V wave. So this is all about the JVP, right? Pause. So that was the brief explanation of the jugular venous pressure. And what are the abnormalities? What are the abnormalities of jugular venous pressure? In some conditions, there is large A wave, like this is the jugular venous pressure waves, right? A, C, V, X descent and Y descent, right? In some condition, the large A wave is produced. Large A wave. Large A wave means how it is produced? Why? What is the reason for the large A wave or canine A wave? See here, again this is the heart. A wave indicates means atrial contraction. When the pressure is increased in the right atria, the A wave, large A wave is produced. Why the pressure is increased in the right atria? Because of tricuspid stenosis or pulmonic stenosis. When the pulmonic stenos means calcification of the walls. When the walls are calcified, the blood may not going into the pulmonary tract from the right ventricle, and the blood may not going to the right ventricle from the right atria. Automatically the blood volume is increased. When the blood volume is increased in this area, it automatically raises the JVP. What are the conditions? Increase the canine A wave, large A wave, tricuspid stenosis, pulmonary stenosis, and sometimes pulmonary hypertension. Pulmonary hypertension, several causes are there for the producing of large A wave, right? See here, observe the pathophysiology. When the A wave is produced during the atrial contraction, A wave is produced. In the atrial contraction, the pressure in the right atrium is increased. In this condition, the tricuspid stenosis and pulmonic stenosis, here the tricuspid valve is present, here the pulmonic valve is present. Due to this tricuspid stenosis, the blood may not going into the right ventricle due to the calcified valves. Leads to increasing the pressure, increasing the volume in the right atrium, which leads to increase the JVP, leads to large A waves. In the pulmonic stenosis, same mechanism may takes place. The blood volume is increased, pressure also increased, which leads to producing of large A wave. So there are main three reasons: the tricuspid stenosis and pulmonic stenosis, or sometimes pulmonary hypertension also may leads to, in all COPD cases also increase to large A wave, right? In some condition, the A wave is absent A wave. when the A wave is absent, right? Here there is no A wave. Why the A wave is not produced during the asystole? There means fast beating of the atria, twitching, fast twitching or fast beating, or sometimes there is no beating of atria, leads to absent of A wave. In which conditions A waves is absent? See here, this is here the large A wave is present in produced in tricuspid stenosis, pulmonary stenosis, or pulmonary hypertension. The absent A wave is seen in atrial asystole, atrial asystole, or what is it called? Atrial asystole, atrial fibrillation. Atrial fibrillation. And in some condition, Kenan A wave is present. Kenan A wave is present. Kenan A wave means large A wave, like large A wave, small remaining waves. That is called Kenan A wave. This Kenan A wave is produced in which conditions? The complete heart block. Yes. Complete heart block, or AV dissociation. AV dissociation. AV dissociation means atrioventricular dissociation. Generally, in the normal condition, atrial systole is followed by atrial ventricular diastole, simultaneously systole diastole, systole diastole. But in this atrioventricular dissociation, atria contracting itself manner and ventricle also contracting in same. Simultaneously, both atria and ventricles are contracting, relaxing. Systole diastole at the same time, which produces Kenan A wave. Sometime in the junctional rhythm also. In the junctional rhythm also, it produces Kenan A waves. Right? This is about the A wave. Pause. And going to X wave. Here, the prominent X descent. The prominent X descent means like prominent X descent. This prominent X descent is present in constrictive pericarditis. See here, constrictive pericarditis. In some condition, there is a prominent Y descent is also present. The prominent Y descent. The prominent Y descent present in tricuspid regurgitation or cardiac tamponade. Right? The prominent X descent is present in constrictive pericarditis, and the prominent Y descent is present in tricuspid regurgitation and cardiac tamponade. So this is about the jugular venous pressure and how the waves are produced, which wave indicates the which phase of the cardiac cycle, and in which conditions A wave is present, A wave is absent, and Canon A waves are present in which diseased condition, and large A waves are present in which condition, and most important is the prominent Y descent in tricuspid regurgitation. In this tricuspid regurgitation, tall V waves are also present, tall V waves. This is the most important thing in the tricuspid regurgitation. The prominent X descent is present in consecutive pericarditis, and prominent Y descent present in tricuspid regurgitation. And so this is all about jugular venous pressure. So guys, so this is very important topic to remember. Exactly one question will come in the FMG and NEET PG and any other competitive exam also. Don't forget about how the A wave indicates with the cardiac cycle, V wave indicates with the cardiac cycle, and don't forget to subscribe to our channel and leave a comment if you have any doubt in this topic. In the next topic, we are going to discuss about left ventricular pressure volume loop. So this is very important topic. In the next class, definitely we will discuss about left ventricular pressure volume loop. Thank you. Have a great day. Keep watching our channel. Please do subscribe.